So I want to end with endemicity because that's how Chris introduced this talk. And it's true that this word is being used, endemicity, because the reason is that COVID-19 does not have features that make it eradicable or an ability to completely eradicate it or eliminate it, unfortunately. But that doesn't mean that we can't live with it. And the word endemic means getting to control. And why can't it be eradicated? Well, the only human virus that we've ever been able to eliminate or eradicate from the face of the earth is smallpox. And there were 4 features that smallpox had that COVID-19 doesn't have. It had no animal reservoirs. So COVID, of course, is found in deer and hamster and mink and multiple other big cats and multiple other animals. It also had smallpox only look like itself, as you can see in the figure on the right. But COVID-19 looks like a number of other respiratory pathogens. So it doesn't have clear pathogenic features. Smallpox had a very short period of infectiousness. COVID is longer. And then even though they both have great vaccines, with time and with the variants, our ability to clear it from our nose has been gone down so that we can still at times transmit it even with the vaccines, even though our protection against severe disease from the T's and the B cells are very intact. And so because of that, if you don't have what's called sterilizing immunity from the vaccines, it's hard to get rid of it. And we don't yet have nasal vaccines, for example. But unfortunately, these other features of the virus will probably not make it eradicable. But what does it mean to get a virus under control? Well, we have many viruses that we live with, and we deal with it, and it doesn't influence the population, it just influences medical care. And 2 examples of that are, for example, measles and pertussis, which I see a lot of as an infectious disease doctor, but in the public, we don't tend to worry about measles and pertussis that much anymore, even though measles vaccines are going down. And the reason is that measles has a highly effective vaccine, and pertussis, which is a bacteria, has not only a highly effective vaccine, but it also has a very good treatment. And so what would enable COVID-19 to be under control and for us to live with it and have the humans and the society have normal life, but have the medical system keep on dealing with it, is vaccines and therapeutics. And I think the oral antivirals, which are really huge advances to treat COVID-19 if you're declined to be vaccinated and are unvaccinated adult, they are extremely effective, especially Paxlovid. And Paxlovid is a medication that actually reduces the risk of severe disease to unvaccinated adults who are at risk for severe disease by 89%. So it's as good as a vaccine for someone who's declined a vaccine. And Paxlovid will also be used for immunocompromised individuals or those who are at risk for severe breakthrough, even if they're vaccinated. So Paxlovid and molnupiravir, I think, are huge antivirals that allow us to say we're getting to control this virus. And so a roadmap to endemicity in schools, because the word endemic means that we do have to just live with the virus, unfortunately, but we have these tools. And at least this is what we suggest. This was written on February 5th, 2022 with the head of pediatrics ID at the University of Chicago, Daniel Johnson, in CNN. And we wrote about releasing mask mandates in schools on metric, because the issue with release, I know many experts are saying, let's release them now. And also indoor mask mandates are being dropped among adults in many Democrat states, and Republican states had already or are dropping now. And so there's this kind of question about whether, why some states are saying in schools, some states are saying not, and it's just kind of all over the place. And the reason that we recommend a hospitalization metric of COVID-19 in the community is that it sort of evens the playing field, that there are places with lower adult vaccination, places with higher adult vaccination, and all of that is connected to number of hospitalizations of COVID-19. So for example, having less than 10 over 100,000 COVID-19 hospitalizations in a region means that you have a pretty low burden of disease. Remember, the usual rate of admission for influenza during a typical year is 50 over 100,000. So we're keeping it much lower for COVID. So that was our recommendation for the hospitalization metric for releasing masks in schools. No more asymptomatic testing in schools, at least per the policy lab at Children's Hospital of Pennsylvania. And I hope I gave you the data beyond that. Symptom-based management, stay home when sick, needs to be much more of a ethos in schools and work, school nurses, and I think restoring joy to school. And we talked about that in lunchtime and so forth.